everybody. Welcome to Meddkit's Provider Spotlight, where every week we are coming here and interviewing the most amazing private practices all over the United States. Every week we come here and we get to learn something new, but most importantly, we get some new perspectives. So today we have a really amazing special guest for you, and I am very excited to introduce you to Natasha Pena. She's the co-owner of Level Up Physical Therapy, located in Virginia. Welcome, Natasha.
Thank you, Rachel. It's nice to meet with you a little bit more in person.
Yes, we are super excited to learn more from you, get a little bit of insight to what you're doing in Virginia. But maybe to start us off a little bit today, maybe you can tell us a little bit more about your background, a little bit about your story, and what inspired you really to open up your own practice.
Okay. So mostly what really kind of inspired me to open up my own practice was after working in corporate for multiple years and just,
Mhm.
seeing the model of going multiple patients at a time.
Sure.
I didn't feel like I was helping the people the way I wanted to, which is why I originally got into physical therapy. I felt like I just didn't have time to invest in them the way that I felt like I wanted to and that they deserved. So after that, and then I met with Martine, who's my business partner, and she
Mhm.
and we're friends, but we've also worked together for years,
Mhm.
and we just kind of had the same idea. Like we're just frustrated with not being able to give people the time that we wanted. So during COVID, we decided to take a leap of faith and open up a small private practice, which was not the ideal time, at least didn't seem like the ideal time. But with our model, it actually ended up working in our favor. So that's kind of how we got to where we are. But it
That's
just really started
amazing.
with wanting to help people.
That's awesome. And it's so nice to have a business partner that you can rely on, someone that you've worked with before and can feel really good entering that partnership with. That you can kind of go through, starting in the pandemic, I'm sure was not easy at times, but here you are 6 years later to tell the tale, right?
Yeah. Yeah. It's been a fun journey, but exhausting one, but a fun one.
That's
So,
awesome. And can you maybe share a little bit more about maybe some of the most common areas that you two are helping treating, maybe things that people are most commonly struggling with. And I think also to that point, there's a lot of things that I think different practitioners are blending lines of. I think you wouldn't
mhm.
necessarily think that a physical therapist or someone else would be helping you treat a condition that it just wouldn't come to mind, like not I'm not out of surgery or I'm not having an immense back pain, but maybe there's some uncommon things that you do and see that are maybe a little bit trickier and maybe a little bit more unheard of. But would love to hear about a little bit more about what you do.
Sure. So of course we're an outpatient clinic. So we do kind of see what you would typically expect to see in
Mhm.
an outpatient clinic. We have our ortho and our joint issues,
Mhm.
our post-op,
Yep.
pre-op, we have our balance issues, all that stuff that you would normally see. We do sports and everything else. So we
Nice.
a traditional outpatient clinic. I think outside of that, um, I'm also a pelvic health specialist, so I treat pelvic health. A
Oh,
lot of times people think that that's just women, but it's also for men as well, and of all ages, for both genders, right? You have from pediatrics all the way up to our geriatrics. We have even our non-traditional genders, right? So you have your
mhm.
transgender and things like that. That people are going through different procedures. So we all have pelvic floors, really. So like it
Yep.
affects everybody. So I think that that is one that it is a kind of up and coming area. More and more
Yep.
people are starting to become aware of it. But definitely, we're still a shortage of pelvic health providers nationwide, and in our area especially as well. There's not
Yeah.
very many. So, on top of that, we really try to treat more of a holistic approach. So, I also am functional medicine practitioner. Some of my Martine's taken functional medicine as well. So, we kind of look at like everything in a root cause. We try to find practitioners to work in our clinic that have a different skill set so we can really kind of look at the whole picture. And so we have one, she does cranial sacral therapy and visceral manipulation,
Mhm.
which again is something that you're not going to see in a lot of clinics. So those are
Cool.
just some of the things that set us apart. But instead of just treating the joint pain, we're treating the entire person from the psychosocial emotional component of it. And there's a lot of research on pain neuroscience and how that impacts our body and our movement. So we're looking at everything from head to toe.
I love that. See, I know there's always more that meets the eye with what people are doing. And I love that you're blending what you're doing on the PT side to functional med and then pelvic floor as well. I mean, I think, like you said, it's up and coming. I think pe people are starting to open their eyes and seeing that there's other pathways. And I think you hit on like a great misconception that like we all have pelvic floors. It's not just for people that had maybe just gone through childbirth.
Mhm.
I think maybe that's people often think about pelvic floor and they think about, new mothers, expectant mothers, and you're like, nope, we help young children too, with their pelvic floor. And I think that's such a great misconception to bring up because, again, there's so much that I think people don't consider, of
Mhm.
all which you can help with. So I think that's terrific.
Yeah,
Yeah.
definitely. And I think the other thing is that not only we do think of it as just new mothers, but um, a lot of times people as we age are told that it's just part of aging, right? So having incontinence or whatever, those are all just part of aging or part of menopause or whatever. Um, and while something's common doesn't mean that it's normal. And so I think that that's probably one of the biggest misconceptions is we think that these things are normal. It's not normal, it's just common. And so I think breaking that stereotype is a huge thing.
I love that. Yeah, I think it's so important to, this is why we do provider spotlight. We want to shed light not only you, but, all the things that we are, not told and or misinformed about, which we'll get to later in this segment.
Yeah.
But we can tell already you have such a great approach, and I'd love to hear a little bit about, what else is different about you all at Level Up and what's really important to you about how you approach your patients and what you guys do differently.
Okay. I think for us, the biggest thing is at the core of our practice is we treat one-on-one for an hour.
Hmm.
So we don't have any techs. We try to stay within two therapists, so you're not bouncing around to everybody, but we really try to keep consistency one-on-one for an hour, so that we can really dive in and dedicate our time to fixing whatever it is that we need to fix to get them back moving the way that they need to be moving to get function in life, right?
Yep.
So that's kind of our biggest focus and the core of, I think, what makes us separated from a lot of the other clinics in our area. I'll say that like doesn't necessarily mean that having that one-on-one model makes us specifically more efficient or makes it
Hmm.
us better than them. It just for us, it allows us to treat the way that we feel we need to treat, um, and give us the time that we want to give the patients, and the patients feel more valued and cared for. That's what we're seeing. So kind of that's at the core of it. You can definitely get good treatment at other clinics. It's not a kind of on them that they're not treating that way, right? But I do
Yep.
hear from people that they just felt like another number, or they didn't feel like they were getting the time that they needed with the therapist. So in our area, that's what's really worked for us, and that's what makes us different from our peers in our surrounding area. But yeah, so we just kind of prioritize that. And we also prioritize our work life balance, which is why another reason why we did what we did.
Yep.
So we want that time to be able to spend with our patients, but then also spend time with our family and things like that. So,
Absolutely. It's so important. People don't often think about that, you know, who you are seeing as your physician, as your clinician, also has a life too, and you have to, be good for yourself so that you can treat your patients the way that you know that they want to be treated, that you want to treat them, and to be able to focus every day. So it's just as important to create your own home work-life balance. But yeah, I hear that a lot too, from a lot of people, and healthcare, just sharing that, yeah, I feel like a number, that maybe this is not the right provider for me. And so it is really important to find that person that you really match up with and that you feel heard. Because I feel like that is, and especially since you brought up the psychosocial part of, how you're feeling and how that, ultimately probably dictates a lot of how people are feeling at the time. And I'm sure they're feeling a lot worse when they're not feeling heard and seen by their provider and feeling gaslit and making them kind of feel worse about their situation, or they're going to see someone too that's helping them with that component, but also is kind of cheering them on along the way and knowing that they've got their back. And that makes that experience and everything that you're going through hopefully that much easier and that much better.
Yeah, it's true. You definitely don't want someone to feel like just another number or just another appointment. Recovery is a partnership. And so, yes, I have the skills and the knowledge, but I also need them to be committed to it as well. And so, when they feel valued and they feel heard, they're more likely to commit into what I'm asking them to do. And that becomes that equal partnership. And then you see good results that come from that. So,
Interesting. Yeah, that's a really good point. And people should definitely consider that when, trying to figure out who their person is, and medical provider is. And, something that you've been bringing up along the way are just a lot of really great points to, what you do, but also to the life cycle of a patient. And I think throughout, healthcare and different specialties, I think we're all kind of plagued with different misconceptions. I think, I'm sure you get a lot and people come in and say, oh, ChatGPT told me this. Is this the right thing to do with, my care? Or my friend told me about this. Is treatment after my surgery really going to feel like that? Or so I'm sure you get a bunch of, different questions, ranging from spectrum to spectrum. But what would you kind of like to debunk for us today? I think, I'm sure there's a lot of things going through your mind, but once and for all, what would you like to throw down today is listen up, people. This is the truth. Um, and this is what you should proceed with.
okay. Yeah, so there's probably a lot of things, but I'll try to keep it to just a few.
Sure.
First things first, I think that it's important for people to understand that a lot of times you'll hear, well, I can't be seen outside of my insurance. I can't afford it. Healthcare costs are too high. I need to use my insurance because I can't afford I mean, like, there's so many things. I think there's a misconception about in network versus out of network insurance usage versus cash pay, and whether people can afford things or not. And I will say, when it comes to your recovery, the question isn't really necessarily shouldn't be can you afford it? It's can you afford not to, right? So we are with Medicare primarily as we're the only in network with Medicare. We do bill out of network to other insurance providers, and we're primarily cash based.
Yeah.
That being said, it's important to us to be accessible to the as many as we can, right?
Yeah.
Um, and so what we really spend a lot of time is trying to explain to people how the insurance works and whether it's more beneficial to go in network, to go out of network, or to do self-pay. And you'd be surprised that sometimes it's actually more cost effective to go self-pay or to go out of network.
Yeah.
Um, and so my one of my biggest things is when we did this was I didn't want anybody to turn anybody away because they felt like they couldn't afford it. I wanted them to understand what they were getting and why. And then I also didn't want anybody to go into financial debt just because they thought or felt like, well, I can get better care here, right? And so we spend a lot of time with clients before they start kind of going over the financial part of them saying, hey, this is what your benefits are in network, out of network, and this is what it would look like self-pay, so that they can make the decision that's best for them. If they come with us, great. We love to have everybody. try to get everybody as better as fast as we can. But we also know a lot of other clinics in the area. So it's like not like a stingy thing. Like I'm going to say, okay, you need to go see this person at at this clinic because they're in network and I know them and they're going to give you good care. Right. So I think there's this misconception where clinics are like, we're trying to hold everybody to ourselves. Um, there's enough people in this world. We have job security. We're not going to run out of clients anytime soon. So I think that that's a
Yep.
big thing is a lot of people don't understand their insurance and how it works. And so there's a lot of times people think they can't afford it. You really can, right? You
Yep.
really can afford out of network. You really can afford cash based. And sometimes it is actually more cost effective. So making sure that they're looking into that and researching and understanding all of their financial obligations is a big
Absolutely.
one.
Yeah,
Um,
that's huge. I feel like often enough, I mean, insurance is very confusing. And I think for those that are not in healthcare, even for people in healthcare that have their own health insurance, you're like, sometimes you're like, what? Like, what are, I called my insurance and they're saying this, and then someone else is saying this, and it's hard and it's confusing. But to your point, explore your options. And, I have also found that a lot of times self-pay, cash pay has also been a lot less expensive than going through insurance. So it's always good to check to see what's around you before just assuming that going through your insurance is going to be the best route and the best care for you.
Right. Yeah. And I think in
Hmm.
the end, it's like if you can afford it's an upfront cost, right? With
Yep.
self-pay, you're going to get hit with the bill one way or the other, whether it's your co-insurance, or your copay or your deductible, you're going to get hit with the bill. You're going to have a portion to pay. With self-pay, you're obviously paying that upfront. And then you can submit to get reimbursement from the insurance company based off of your agreement for out of network if you have out of network benefits. So that's the thing. So definitely look into it, research. And if you're going to see a provider, they should be willing to have this discussion with you and saying, hey, yeah, we can do this, we can do that, or this is what it looks like. But also call your insurance company. They're not going to want to tell you that because they're going to pay the least amount possible. But surprisingly, in the end, sometimes it's cheaper for them as well for you to do self pay and then
Yep.
reimburse you. So, I mean, it's just that's one that just blows my mind continuously of how misleading it is for, and people think that, well, I have this insurance, I pay for it, therefore, I have to use it. And it's sometimes not always the
Yep.
best case
Yep.
scenario. Um, I think that's probably the big one, is,
No, I
you
love
know,
it.
just
I think
looking
that's
at,
great.
yeah, and kind of weighing your options. Like, changing perspective into can I afford not to do this, right? And sometimes it is paying a little bit more, but again, it's your health, it's your recovery, it's your body, your life. So looking around and weighing your financial options, um, checking out clinics. We have people come in all the time that just want to take a look around and see what the clinic is like,
Sure.
how they have questions about how we run things. Um, Interview, right? You're interviewing them as well, just to kind of see, like, are you going to get what you're expecting, right? Advocate for yourself. It's your care. You're
Absolutely.
paying for it with or without insurance. You're paying a portion of it. So make sure you're
Yes.
getting your value so that you can maximize your recovery.
Yeah, and man, I just love this series because, everyone has, like I said in the beginning, different perspectives. And I think it's really refreshing hearing that from a provider. Because I think to everyone else's point, they're nervous about stepping into a new relationship. It's like dating, right? Like I'm a little nervous. I don't know what to expect. And it's so great to hear you say, like, I want you to come in and I want you to see what's here, and I'm happy to do that. So you can know the value that we're providing, and knowing that we're going to give you the best care, and we want to show you that. And I think, to your point, all of this is so nice to be said because, again, often enough, yeah, people are also waiting to take care of something because, they're like, oh, like, can I put this off? Should I put this off? Do I do it later? But to your point, you have one body. And I love to emphasize that it has to take you through your entire life. And so instead of waiting for, the rock to come through the glass house, and knock it all
Mhm.
down, because maybe something was really minor that just, had expanded and gotten worse from there. Maybe if you were to take care of it earlier, it won't be as big of a heart or of an issue to take care of in the end. So, a little bit of preventative care as well. Um,
Yes, I wish we moved into that a little bit more in our society.
right. Right.
Yeah.
Yeah, totally agree. But to that point, and all the amazing knowledge that you've given us so far, Natasha, I'd love to round things out today with some of Natasha's pro tips. So I'd love to hear from you what, you might give as common homework to any patient or client that you might have, something to move their health, or trajectory of an injury, just even further, more this way than this way, right? So
Mhm.
what can we all do today to enrich our health, our lives? And then, as you had your business for many years, and I'm sure a lot of the folks who are listening that are there as well, but also maybe starting out new, what are some pro tips as a business owner that you can offer some of these people?
Okay. For patients or I find pacing is a big thing, right? We tend to live in a very fast-paced world. Um, and we're really quick to do things for others, and we're quick to let ourselves down or put ourselves on the back burner. So, first thing I would say is pacing and making sure you are taking care of yourself just as much as you're taking care of others. Um, I think that's a big one. Um, I will say when it comes to like physical therapy, some of the best things I can say is come dressed to move. Surprised how many people come in clothes that are not appropriate for PT. But honestly, we're movement experts. We need to see your body move. We're going to ask you to move. So we need you to come prepared to move. We need you to come prepared for us to access those areas in which you're coming for. So if it's your hip or knee, we need you in shorts. If it's your shoulder, wear something, a tank top or a button down shirt that where we can access the site that we're looking at. But we are going to ask you to move.
Yep.
Um, commit to the plan, right? During the evaluation, the therapist is going to come up with a plan. They're hopefully discussing it with you. And again, this is a partnership in recovery. So um, your plan should be something that you could obtain and something that you can do throughout. So you need to
Yep.
commit to that. And if it's something you're like, that's just too much, it doesn't fit my schedule, then you need to talk with a therapist and advocate for yourself so you guys can come up with a plan that is one that you can commit to. And
Absolutely.
then lastly, and I think this goes for just about everything in life, but especially healthcare, is to be your own advocate, right? If something doesn't feel right, speak up. Um, Therapists are good and we have knowledge. We go through lots of education for it,
Mhm.
but we are human as well. And so we need that feedback. Don't just push through something like I want my patients to tell me how they're feeling. Is something working, not working? Are they, so that we can adjust accordingly so that we can get them the best treatment plan and get them better as fast as we can. So I encourage them to advocate for themselves and I just think that's important in life is just to advocate for yourself, which we don't
Yeah.
do enough of.
100%. Yeah, I think everyone's guilty of that one. I
Right.
think we, like you said, put ourselves on the back burner, or afraid sometimes to say, hey, I'm seeing this. They don't want to be confrontational, but it's really important to speak your mind, see something, say something, feel something, say something. Um,
Right.
I think we could
Yeah.
all take a page out of your book on that.
Well, thank
Um,
you. And
yes.
then yeah, I was gonna say, and then for providers, I think is you got to figure out kind of redefining success and what success means to you, right? Definitely taking a pay cut when we opened up our clinic, right? Because we stepped back. We're not seeing as many patients as we were at the previous place we were working. So obviously the revenue is not as much, but for me, the success is that I'm able to spend that time with my patients, get them better faster. And I also have a work-life balance, which I didn't have before. I don't have that burnout. in the
Yep.
same way, right? Um, and then build your practice, whether you're a business owner or you're just a clinician, you're you're practicing, and you want that to be based off of your values and that of what your clients, so you want to make sure that you're modeling your values and what your
Yep.
prospective clients are, the ones that you want to treat, right? That it matches their values. And as long as you're doing that, you're on a right path, right? The money will come in
Mhm.
time, right? As your reputation grows, as your skills grow.
Mhm.
And as long as you're modeling your values, you can't really go wrong. And then the last thing is just protect your energy and your autonomy. Like, honestly, that is a big thing. We're seeing such a burnout in the healthcare industry right now. And a lot of it is because, like, we've got to have jobs, we've got to pay bills, we've got to do all of this. Well, you got to have a job that pays you the money to do things. So people are taking jobs for money, and getting burnt out because they're having to, well, you have to earn your money to some degree,
Yeah.
right? So if you're going to ask for a certain amount, you're going to have to see enough patients to be able to kind of make that amount for them to pay it. So there is a give and take. And that's why I say you have to protect your autonomy and your energy, and you decide where your values lie.
Absolutely.
So those are, I think, more important than the financial gains, because again, we only have our one life that we know of.
Yep.
And so you need to maintain a healthy lifestyle and a healthy balance, and that mental, and physical and just energy amount. Like that, there's a balance, and we have to maintain that. So
100%. I couldn't agree more, and I'm so glad that you spoke on all of that because I think sometimes people we know that, but it's we have to be reminded, especially when you are working crazy hours, you are in the midst of maybe some burnout and need to take some reflection to, better that for the future, or you just need to hear a soundbite just like this and say, Natasha's right. I need to prioritize a couple of things and I'm going to get better. And that's what this is all about is putting out the right information, putting out, reminding people about what's important in life, what people do, what makes them special. You're doing so much to help your community. And so it's great to be able to spotlight you. And we so appreciate all of your knowledge today. And on that note, if you wouldn't mind sharing with us how people can grab some resources from you, where they can reach out, that would be terrific.
sure. So our website is levelupptva.com. Facebook, it's just Level Up PTVA. And then Instagram, it's Level Up PTVA Seville for Charlottesville. And you can find us there. We post little fun things daily, more informational, just things to kind of keep your life going and keep you moving. So find some fun tips there. And then, yeah. So,
Awesome. Well, we really appreciate it, Natasha. This has been fantastic. And I know we have so much more to talk about in the future, so we'd love to have you again.
well, I appreciate it, Rachel. Yeah, anytime. Got lots of fun topics to discuss.
Awesome. Thanks so much.